Good morning, everybody. My name is Joe Stratman, and I will be moderating this session. Welcome to ISS. I will be also giving out the CEU code at the end of the session. Please remember to keep everybody's mics muted and videos off. And if there are questions, we will hold them until the end of the session, and we'll be able to turn it over to the speakers. So I will let Rosaria Caforio take it over from here. This is ICO3, Emerging Needs During the Pandemic and Innovation During Lockdown, Posture Management in ICUs. So Rosaria.
Okay. Hello. May I start my presentation?
You may begin.
Okay. Hi to everyone. Here is 4:30 p.m., so afternoon, and good morning to all of you. Finally, we had the opportunity to meet each other in the cyberspace. So thank you to ISS organizer for the hard work they made to make it possible. As suggested by the organizer, we will have the discussion and the question answer at the end of the section. So I leave to you sufficient time to go in deep in. I disclose now my conflict of interest. I, Rosaria Eugenia Caforio, have an affiliation with a medical device organization. The organization name is ProMedica SRL, based in Italy. I am the managing director of the company and I have ownership interest in it. Also, I am part of the ownership and inventor and designer and author of both patents for invention and design submissions for the product referred to in the presentation and marked by ProMedica. Learning objective of this course will be list 2 pros and cons of prone and supine position in patients with ARDS, describe the consequences and management problems of pronated patients in intensive care units, describe the appropriate skills for managing the positioning of pronated patients. I'd like to introduce you shortly ProMedica. It is an Italian company located in Puglia region and since 25 years develops postural solution for the most complex positioning needs of wheelchair users. March 2020 was the apex for the first pandemic wave in Italy. Calls for help came from everywhere, from government, from clinicians. There were several emerging needs. We required fast actions and fast developments, protection items, new ICU and sub-ICUs beds, trained clinicians and staff, ventilators, devices to manage the big amount of patients. For the first time I can remember, it was a big cooperation between the government, hospitals, clinicians, industry, charities, citizens. I myself, for myself, and in behalf of my company, I called our entire network to ask how we could help. The last Sunday of March 2020, very early in the morning, I received a phone call from a university polyclinic. He was the head of the ICUs who asked me, "Can you help? We have a big issue. to manage patients' posture in prone position. I was honored to make my and my company background and experience available. It was Helix history and a new learning experience for all of us. So we tried to understand why patients were prone and what the issue at the origin. Patients were prone due ARDS. ARDS is acute respiratory distress syndrome, acute diffuse inflammatory lung injury leading to increased pulmonary vascular permeability, increased lung weight, and the loss of aerated lung tissue. With hypoxemia and bilateral radiographic opacities associated with increased venous admixture, increased physiological dead space, and decreased lung compliance. It is classified in three ranges of severity: mild, moderate, and severe. Mortality rate is for mild 27%, in moderate 32%, in severe 45%. This severe form needs patient intubation and mechanical ventilation. An amount of patients affected by ARDS during the pandemic need to be pronated. Prone positioning during COVID pandemic is approximately 55 people affected by COVID developed severe disease that requires oxygen support, and 5% have critical disease with complications such as respiratory failure, acute respiratory distress syndrome as ARDS. Critical management of this critical disease, recommendation made by World Health Organization were pertain to mechanically ventilated adult and pediatric patients with ARDS. Require application of prone ventilation that is recommended for adult patients, preferably for 60 hours per day, and may be considered for pediatric patients with severe ARDS, but requires sufficient human resources and expertise to be performed safely. Another important key and suggestion is the patient turn every 2 hours to reduce incidence of pressure sore. Some numbers of ARDS out the pandemic. There is an observational international multicenter study conducted during 4 consecutive weeks in the winter of year 2014 in a convenience sample of 459 ICUs from 50 countries across 5 continents. ARDS is at the 10.4% of ICU admissions. And the main risk factors are pneumonia, aspiration, inhalation, extrapulmonary sepsis, trauma, non-cardiogenic shocks, blood transfusion, pulmonary contusion and vasculitis, and drug overdose. Why is used prone position? In patients with severe ARDS, early application of prolonged prone position sections significantly decreased 28-day and 90-day mortality. Prone positioning is nowadays considered as one of the most effective strategies for patients with severe acute respiratory distress syndrome. The evolution of pathophysiological understanding surrounding the prone positioning closely follows the history of ARDS. At the beginning, the focus of prone position was the improvement in oxygenation attributed to a perfusion redistribution. However, the mechanism behind the prone position are more complex. Indeed, the positive effects on oxygenation and CO2 clearance of the prone position are to be ascribed to a more homogeneous inflection ventilation, to the lung thoracic shape mismatch, and to the change of chest wall elastance. Prone position is recommended in alternating 12 to 16 hours cycles with the supine positioning. It is a long process and requires a big amount of time, strength, and very well-trained staff, made composed by doctors, nurses, physios, and we will see later OT, occupational therapists. The process is very long because it requires many time to prepare the patients before to be rotated. And is a very, it comports a lot of risk for the patients because the displacement of tubes, catheters, marks are very frequently, and it can be the fatal event for the patient. Staff members required to do this operation are since 2 to 10 people, and it requires a lot of strength in terms of physical strength. It requires doctors at the head of the patients and other doctors to monitor all the parameters of the patients, the vital signs. Which are contraindications for proposition? Serious bars, open wounds on the face or ventral body surface, conditions associated with the spinal instability, for example, patients with rheumatoid arthritis or trauma, pelvic fractures, life-threatening cardiac arrhythmias or hypotension, conditions associated with the increased intracranial pressure. Consequences and the complication of prone positioning are higher than in supine position. And most common find into literature are facial edema, pressure ulcers on the face, chin, pelvis, chest, knee, feet, tibial crest, abdomen, genitals, coughing, compaction, respiratory problems, cardiac dysarrhythmias, necrosis of the mamilla, dislocation of the tracheal tube or venous arterial lines, nerve damage, and brachial plexus lesion. Here we can see some example of consequences as facial edemas and pressure ulcers to the mouth, all the face, on the sternum, on the thorax. How some consequences can be prevented. Some options are stomach decompression to avoid the gastric pressure, partial reposition each 2 hours or less, microshift, air cushioning beds, pillows and foam supports, sometimes also fluid supports, avoid friction share during a reposition, rehabilitation-based prone team made by physio and occupational therapists added to ICU standard team, and alternate swimming freestyle position. This point 5 is very interesting because there is this study called Propositioning of Patients with Acute Respiratory Distress Syndrome related to COVID-19, a rehabilitation-based prone team that explain how all the background in a rehabilitation field can be very, very useful to help this patient, and all the intensive care team also, because the experience of these people, this background can help in align the body of the client, reposition, and in avoid and contain the spread of pressure ulcers. So it's very useful to go deep because can be something that in many places in the world is spreading. From positioning, not is suggesting only for severe arts, but there are some fields where it is already applied, others under research, as for comatose ventilated patients to reduce the incidence of lung worsening, during anesthesia on the operating theater, during spinal plastic surgery and treatments, in patients with the mid to moderate ARDS in combination with helmet positive airway pressure, in order to avoid the deterioration of gas exchange and intubation, and this is under research. In treatment of pulmonary edema, this is also under research. In treatment of obstructive sleep apnea, in treatment of movement disorders and postural patients, and in physiotherapeutic treatments. But now, we coming back to call for help in that Sunday morning of March 2020, how we help it and what we develop. With the inputs received, the basic concept was to create a total body system able to deload and suspend all the body critical points, as all the parts of diaphragmatic, abdomen, and genitals, and knee, elbow, face, feet. Avoid the conflicts with device and tubes, cannulas, and mask. Taking the possibility to the face to be free without nothing in contact, and allow patients face inspections. To fit gender anthropometry and morphology differences, to allow postural changement during use for each body segment and for the whole body, and the kit of independent, modular, and adjustable components able to support, fit individually, and address individually both gender, morphological, and anthropometrical differences, as well as the individual position left and right side of the patients. We considered adult patients with height between 160 and 190 centimeters. That means 63 inches and 75 inches height. And then to allow department organization, in fact, we thought at a mobile station, and to drive and minimize operations of the clinical staff. So we developed a chart with method and steps and colors to print on the top of the mobile station. And then to quickly identify components and steps, then colors and numbers on components and planes of the mobile station, also labeled to quickly recognize. All these points to save the time of the staff, to organize the warehouse of the components, avoid mistakes, and transfer helix between beds of the ICUs. Other important scales for developments were materials. At the deal to make the device safe and with a long and intensive use. In fact, covers materials are breathable, waterproof, antibacterial, non-cytotoxic, not irritating, resistant to virus penetration, antifungal, fireproof, biocompatible, and latex-free. And then to prevent infections, in fact, each component is sanitizable with ethanol 75%, and to use for many patients. In fact, each component cover can be washed 10 times at 95 degrees Celsius or 203 degrees Fahrenheit, and can be sterilized 10 times at 135 degrees Celsius and 273 degrees Fahrenheit for 5 minutes. So the time can be, the use can be prolonged for many patients. Generally, the devices used in intensive care units are devices that the people dismiss after the first use. Now we'll see in the next slides all the components of different groups and their function and steps for application. In total, there are 7 steps to apply the helix, and it will take 10 minutes maximum for each patient. The device allows pressure distribution, postural containment and alignment, thoracic and diaphragmatic decompression, head positioning, lower limbs, knee, elbows discharge, variation of the total and segmental posture. In the pictures are showed how each component have inside other components to be customized application. We'll see the step 1 that is relative to the group 4 to manage hip joint articulation. This is a support and containment kit. Step 2 is the thorax support and it will be useful to support and contain all the rib cage. This will have individualized discharge and suspension for abdomen, diaphragm, lungs, and support for pelvis and rib cage. Then we will have the step 3. This is the kit for clavicular, underclavicular support. This is splitted to leave sternum free, and the good application is between the sternum and the shoulder articulation. This will give to the client, to the patient, individualized discharge for breastbone, clavicula, lung, acromion, adaptability for anatomy and morphology of men and women. In fact, inside and outside each component are several wedges that can be used in a different way if we have a man or a woman, and depends from the woman mamilla volume also. And here in this imaging on the left, in the bottom, we can see the group combination between pelvic, thoracic, and clavicula, where we can decide how much inclination give to the trunk and how much suspension we want to have for the patient. In this way, we can customize the load distribution, and we can suspend the pectoralis and genitals and give harmonic support to the pelvis, rib cage, and trunk inclination customized. Step 4 is positioning the head. In this step 4, we have a headrest with the 4 elements that represent an helix is the name of the product for this design of the headrest, where we can combine inclination and rotate and combine 2 or more components to follow the rotation, inclination of the head, and give the possibility to the head to be rotated or vertical respect to the mattress. This can be useful for pressure distribution and support the neck and the head in every inclination and position, and freedom to the face, maneuver, and inspection space. Another important things is the possibility to move each element and microsheet the head every moment. Another important thing is that no fixing system are required, because the element base is no slip too, and also the elements in the bottom are no slip. In the bottom, we can see the combination of the groups, pelvis, thorax, clavicular, and head, for have a customized load distribution, pectoralis suspension, and harmonic support for rib cage, neck, and head. A customization of cervical lordosis inclination. This is very, very important, because most of the patients pronated are intubated and with the tracheal. So to have the possibility to give a different inclination to the head and decide and manage cervical lordosis can avoid the trauma in the here where the tracheal tube is inserted. So avoid lesion inside the body of the person. Here we have the step 5, where we can manage inclination of the leg and articulation of the feet. So this kit has in the bottom another wedge, so we can decide during the time of use to change the inclination, and this can be very, very useful, like an exercise for the patients. Then the step 6, that is the component containment kit for leg and foot support. That is this like a banana. Inside there are wedges, so we can decide how much go inside for the knee articulation. And in the bottom, we can see the group combination between pelvis inclination and support for all the inferior leg and femur. This can be can give body load distribution and joint harmony between the pelvis and lower limbs. After that, the steps 7, where we have the elbow joint support and containment kit made as the knee kit. Can give elbow discharge, upper limbs individualized suspensions, and inclination. Sometimes this kit can be used for the hand also, because sometimes in many patients, arms are positioned in swimmed position. So one of these is used to support the hand. And here in the bottom, the group combination for minimization of pressure, pectoral suspension, and harmonic support for rib cage, neck, and hand. Each component, one moment, I come back. Each component has a supplementary kit of TNT disposable covers. So if the department want to use to prevent and maximize the use of the product during the time, this can be useful to do it. Each component has is a specific design kit for covers in TNT disposable. Okay, so now we can see here Helix in the configuration with the mobile station and the patient after Helix application. This is a patent pending device, is a class 1 not sterile according to the EU regulation 7045. Helix can maintain its position through the combination of the load exerted by the patient's weight and the friction between the non-slip material covering the surface on the bottom of the elements and the non-slip material of the mats that are placed under the elements. It can be used with every mattress and bed for ICUs department because the non-slip material and the design can be used very safely also in condition of movement of the mattress. And in November 2020, ProMedica has been selected in the context of the two important initiatives. The first one is the plan of Italian government to increase the numbers of beds in ICUs and sub-ICUs. In fact, ProMedica was contracted as a supplier together with other 3 companies for prone position system to equip the new bed place in all the Italy, and this contract included education for people and team of ICUs and the services for 2 years. And the second one was selected, ProMedica, together with other 24 companies in a portfolio of 400 companies to benefit for technical support to increase production capacity, funded by American agency USAID. And we benefit of technical support, and we were very honored to be part of this program. At the moment, we have in Italy around 70 hospitals. They are using Helix, and around 200 beds equipped in intensive care units, and staff trained in all the Italy. So I thank you for your patience, and especially for support my English that is not very good. So I would like to show you more deeply the product, and I will be very happy to receive a question or what you need. Thank you. This is the mobile station. The mobile station is very useful to go through beds. So generally, the guideline in Italy to equip the intensive care units are 4 beds, a system for pronation. So we thought it would be easier to go very quickly within the bed and to have all the material together and have all the instruction for several staff alternation. And on the top of the station, we have the guide with all the steps and the group to bring, all the code for products for order several covers when the product is used, and each color and group is reported on the plane of this mobile station. So the people is very useful to bring the product, use on the client, on the patient, and then put again on the mobile station. Another instrument we thought very useful is the illustrated guide to how to position the parts obelis on the trunk. This can be trained put on the wall of the department. It's very useful because in this department there is an alternating of staff, and especially during the pandemic, not all the staff was permanent in the department. So, and this is the main suggestion for the people to use. Also, we create a video tutorial to live in the department together with the product, because every new people came into the department, every new nurse or doctor or physio can see again the tutorial and train itself better. In the mobile station, we will see all the components and all the slippers and a first kit of TNT covers. These, for example, is for the part of the head. This for the head is very useful when the patient is placed on the bed to have all the secretion, because these patients have a lot of secretion, and this can be very useful for staff to bring and leave to have a maximum hygienization of the patient. And here on the bed, you will see placed a skeleton mannequin to show how the product can be placed. And unfortunately, this skeleton is very short because it is 150 inches, 150 centimeters. So 10 centimeters less the height of the standard patient. But I want to show how each material is stable, because the material on the bottom and on the slipper is anti-friction, low friction material. We can round in every position, and if we need, we can change the thickness of the material to go deep or less deep immersion. Another important is this, because we can rotate each part and give more inclination from one side respect to the other side of the patient. Or it will be needed, can we use the edges. So if we have a woman, a shortener, or we can manage exactly what she needs. An important feature is that when the patient is on the bed already prone, with all the other system, the staff has to exert a big amount of force to hire the patient. With the solution with the gloves, it is we need just 2 people to do the operation. 1 people from the right side, 1 person from the other side, and 1 people exert another insert the part under the bone and the body of the patient. Another important feature is the part under the axilla. Inside we have several components with the shape to not create a lot of pressure, especially for the women, the mamilla. So we can decide to have different suspension under the clavicle. In intensive care units, the head can be vertical in neutral position, okay? And imagine neutral position the head under the mattress and with the mask, oxygen mask, tube, tracheo. This is an amount of material under the skin that create a lot of pressure. So what we thought is to create a system very, very modular to maintain. So it is possible also to sustain here. Unfortunately, it's not articulated, the skeleton, so this is not much clear to see. But we can create support at this point without pressure and leave all the nose freedom. In other cases, the head is rotated, so sometimes we can use just 2 or 3 components to support the head without any pressure. Under there is the big sleeper, and the head is very stable. Under these parts for the head, there are different wedges to support different inclination, given by all the pelvis, thoracic, and clavicular support. And for the head lordosis. I think I have finished. If there are any questions, please. Unfortunately, probably you have to repeat or in the chat. So
We had one question, Chad. What kind of foam is used for the positioning devices?
are different kind of foam. We have the rigid structure with polyethylene foam, and inside the padding, the foam is a combination of memory and elastic foam. And then, yes. That was, I was thinking for multi-use, etc. Thank you. What do you do if the client doesn't have a full shoulder range? Okay, if the client has not a full shoulder range, it's possible to manage this way. but this luxation is very, very frequent in intensive care unit. So generally, the people, because what happened? Happened that people, the staff in intensive care units are very focused to save the life to the patients, okay? This is their main focus. Because this focus, they don't think to the posture, and they don't think what they do when they do operation to articulation, to skeleton of the patient. This is why in the last, in what happened during pandemic, that very often started the team into the ICUs with the rehabilitation background. This is why started to be occupational therapists, physical therapists there with experiences and background in rehabilitation to manage and prevent problem to the shoulders, problem to the retraction, to the legs, etc. And then I like the possibility to vary the patient's position for skin safety to prevent the patient from developing deformity. Yeah. Thank you. Okay. If if there are other questions, I will be happy to. I'm here. I have half an hour, so. We as company were very happy to do this, and we have learned that posture management is very, very useful. And also in the pandemic, emergency, there was an opportunity and an occasion for ourselves to give our support. And I'm curious what can be the experience of the feedback in our institutional market, probably for manage movement disorders and also to manage high tensor tone in comatose patients. Could be interesting to try. Because I cannot see you, because I just can see chat, I don't know what kind of background are the people there. And I would like if there is some feedback regarding what use can be imagined in the field of rehabilitation about helix in posture management of wheelchair users. Is there something?
If anybody has anything they want to say, they can raise their hand and I can unmute you. I can turn your video on, whatever you need. You can let me know.
Okay.
Anybody have any other questions? If not, I can put the CEU code in the chat for you guys. Rosaria, thank you very much for your presentation. We appreciate it very much.
Thank
For
you.
those of you who need the CEU codes, I will tell you that one right now. Let me pull it up. It is 7Y6W39, and I will put that in the chat as well for you guys. Looks like we do have another question. From your experience, how many people were required to turn the person from supine to prone?
Minimum 5. Minimum 5. 1 at the head of the person and 4, 2 on the left side and 2 on the right side. No, absolutely no move the people in a second bed. All the operations are made in the bed of the patient. Imagine I was in intensive care to give the first training to the product, to the team. And in my life was the first time I have seen myself in a war theater. It is terrible to see that department. There are a lot of machine, a lot of computer. There is 3 people seated in a table, and these people look at the screen. Okay, on this screen there are all the vital parameters of every patient. In a bed, every bed has 2 columns or sometimes 4 columns, independent on how many machines are connected and how many computers are connected to that patient. So it's impossible to move a patient from one bed to the other one. Every movement can be the end of the life of the person. So. Okay. Thank you. I hope in the next years to be again in the States and meet some people there I know and some friends and share personally, in person, the excellence of International Sitting Symposium. Introduction. Thank you. Ciao. Ciao. Stanno andando. Okay. Ciao. May I go out?
Yes, it looks like we're jumping off. So thank you again so much.
Thank you again. Bye. Bye. See you.
Yeah.
Have a nice day. Bye.
You too.
Bye.
And Michael, you can